What is colon cancer screening? Colon cancer screening is a way in which doctors check the colon for signs of cancer or growths, called polyps, that might become cancer. It is done in people who have no symptoms. The goal is to find and remove polyps before they become cancer or to find cancer early. Studies show that having colon cancer screening lowers the chance of dying from colon cancer. What are the different screening tests for colon cancer? Colonoscopy allows the doctor to see directly inside the colon. Before you can have a colonoscopy, you must clean out your colon. You do this at home by drinking a special liquid that causes watery diarrhea for several hours. On the day of the test, you get medicine to help you relax. Then, a doctor puts a thin tube into your anus and advances it into your colon. The tube has a tiny camera attached to it, so the doctor can see inside your colon. The tube also has tiny tools on the end, so the doctor can remove pieces of tissue or polyps. After polyps or pieces of tissue are removed, they are sent to a lab to be checked for cancer. Colonoscopy finds most small polyps and almost all large polyps and cancers. This test gives the most accurate results. If any other screening tests are done first and come back positive or abnormal, a colonoscopy will need to be done for follow-up. Colonoscopy has some risks. It can cause bleeding or tear the inside of the colon, but this only happens in 1 out of 1,000 people. Also, cleaning out the bowel beforehand can be unpleasant. Plus, people usually cannot work or drive for the rest of the day after the test. Stool test for blood. Cancers and polyps can bleed. This test can find even small amount of blood that you cannot see in your stool. Other less serious conditions can also cause small amounts of blood in the stool, and this will show up in this test. An advantage of this test is that it does not involve cleaning out the colon or having any procedure. Stool tests are less likely to find polyps than other screening tests. These tests also often come up abnormal, even in people who do not have cancer. Sigmoidoscopy is similar in some ways to a colonoscopy, but the test looks only at the last part of the colon. Before the test, you must clean out the lower part of your colon using an enema. This bowel cleaning is not as thorough or unpleasant as the one for colonoscopy. For this test, you do not need to take medicine to help you relax, so you can drive and work afterward if you want. Sigmoidoscopy can find polyps and cancers in the rectum and the last part of the colon. If polyps are found, they can be removed right away. In about 2 out of 10,000 people, sigmoidoscopy tears the inside of the colon. The test also can't find polyps or cancers that are in the part of the colon the test does not view. If doctors find polyps or cancer during sigmoidoscopy, they usually follow up with a colonoscopy. Stool DNA test is another screening tool. It checks for genetic markers of cancer as well as for signs of blood. For this test, you get a special kit in order to collect a whole bowel movement. Then, you follow the instructions about how and where to ship it. When cancer is not present, it is less likely to be falsely abnormal than a stool test for blood. That means it leads to lower unnecessary colonoscopies. One disadvantage of this test is that it might be unpleasant to collect and ship a whole bowel movement. There is no blood test that most experts think is accurate enough to screen for colon cancer. Who should be screened for colon cancer? Doctors recommend that most people begin having colon cancer screening at age 45. People who have an increased risk of getting colon cancer sometimes begin screening at a younger age. That might include people with a strong family history of colon cancer and people with diseases of the colon called Crohn's disease and ulcerative colitis. Thank you for listening. Please click like, subscribe to Diseases Simplified, and ring the bell for more health tips and updates.